Hello, friends. Today, let's talk about red flags of cervical cancer. Although, and in a very good way, the number of cases of cervical cancer and deaths because of cervical cancer have been declining over the last few decades. And that is thanks to the very efficient screening programs and the HPV vaccination programs that has brought down the number of cases and deaths because of cervical cancer. However, there are still many ladies who get impacted by cervical cancer. What are the red flags of cervical cancer which we should, if we see them, if we detect them in ourselves, then we should seek medical help immediately? What are the risk factors which make one more prone to get cervical cancer? My name is Dr. Avril Watts. I am a clinician with NHS Scotland, and I am also a scientist by training. In today's video, let's talk in a bit more detail about the red flags and risk factors of cervical cancer. Let's go. Among the red flags of cervical cancer, one of the commonest one, or one of the most important one, is abnormal vaginal bleeding. Abnormal vaginal bleeding could be, for example, bleeding happening after vaginal sex, bleeding starting after menopause has happened, so the periods have stopped, and after that there has been spotting or there has been bleeding. Periods have started after that. That is a red flag for as abnormal vaginal bleeding for cervical cancer. If there is bleeding in between the periods, so it could be spotting even, or it could be proper bleeding in between the normal periods, that can be an indication that one should seek medical help immediately. If the periods have become longer in duration or heavier than normal, that could be another indication. So one should get checked up and get cervical cancer ruled out. If there is a foul-smelling vaginal discharge, which otherwise has been tried to be treated for infection, but that is not going away, and the foul-smelling discharge continues to happen, then it could be a sign, it could be a red flag for cervical cancer. Please go and get yourself checked up. If there is pain after sexual intercourse, after vaginal intercourse, and it becomes painful, and that continues to be the case for days and weeks, then please go and get yourself checked up and get cervical cancer ruled out. If there is a new pain in the pelvic region, which is just there, and despite your best efforts, despite taking different treatment, it's not going away, that could be a sign of cervical cancer. So these are the key ones, which as soon as they appear, we should seek medical attention and get cervical cancer ruled out. So these are the commonest red flags. In addition to these common red flags for cervical cancer, there are some other, you can say them as red flags, but they are difficult to keep track of because these signs and symptoms can be seen in other diseases too. But if you would have any questions or comments about these red flags, just feel free to leave a comment in the comment section, or a question. I would definitely get back to you. Other red flags which are difficult to keep track of are if there is a persistent sensation of itchiness or burning in the vagina, which is persisting for days and weeks, that could be a sign. Tiredness which cannot be explained otherwise. You're eating well, you're sleeping well, you're doing your exercises well, and this new tiredness has set in, which is just you're unable to shirk it off. That could be a sign of cervical cancer. If there is low abdominal pain, or sustained persistent low back pain, which is new, and despite your attempts to shirk it off or try some painkillers, it's not going away, and it's not musculoskeletal, which you have already tried treatment for. If these pains in the lower abdomen or the lower back are persistent, that could be a sign of cervical cancer too. If you feel urgency to go to the toilet for passing urine, or you're going more number of times, this could also be a sign of urinary tract infection. But urinary tract infection, or a UTI, should be resolved after a course of antibiotics or 2 courses of antibiotics. But if it's still persisting, that could be a sign of cervical cancer, and then please go and get yourself checked up. Having abdominal bloating, persistent abdominal bloating, is again one of those red flags which are very easily missed. and you yourself or even the doctor can easily miss it and not look at it as a red flag. But feel free to remind the doctor and get cervical cancer ruled out if you're feeling bloated persistently. So these are those kind of red flags which are difficult to detect, and one should keep an eye on them. Then there are certain signs and symptoms which appear once the cancer has progressed to a stage that it is either spreading or it is impacting other organs around it where it is spreading. So it is at a later stage. In some patients, we do see if there is swelling in the legs. So, both sides there is swelling in the legs, which is again persisting, and despite treatments for other things, it's not going away. Then again, one should get cervical cancer ruled out. Additionally, if you have sudden new issues with passing urine, difficulty in passing urine, and again, you have gotten yourself treated for UTI, but that's not helping, or if there are new issues for passing stools, and again, you have treated yourself for constipation, for example, but it's you're having troubles, or new diarrhea has set in, which is just not going away. So these new symptoms of having troubles with urination or troubles with opening your bowels, these could be a sign of kind of late stage cancer. In this case, we are talking about cervical cancer, so that can well be the case of cervical cancer. So please do get it checked up. If there is blood in the urine, which is again persistent, blood in the urine can appear due to infection, but it should not last beyond 1 week, or 1 week after. If it is lasting beyond 1 week after the treatment has been taken for urinary infection, it is a red flag. So definitely go and get yourself checked up. So these are the red flags which appear once the cancer has spread out. In addition to these red flags, there are certain risk factors which increase our chances of getting cervical cancer. Now, these risk factors, it doesn't mean that anybody who has these risk factors will go on to get cervical cancer, but it's good to keep them in mind, because if you have some sort of red flag appearing and you also have risk factor, that just increases the chances of getting cervical cancer, and it makes it that much more important or to go and get things checked up in time. So what are these risk factors? The first and the foremost one is human papillomavirus, the HPV. Now, luckily, in the Western world, in countries like US, UK, and other Western world countries, there is a massive drive with vaccination against HPV, which we start in children in teenage years itself. And that has brought down the HPV infection, and that has brought down cervical cancer. So, but HPV infection, which can be asymptomatic, which can just be there in the early years, in late teenage years, and that can go on to lead cervical cancer otherwise if that has not been taken care of. So HPV is a risk factor. Anybody who has HIV or any other immune compromised situation, that can be a risk factor for cervical cancer. Any lady who had first full-term pregnancy before the age of 18 to 20 years. So early full-term pregnancy is a risk factor for cervical cancer. Multiple pregnancies, more than, let's say, 3 pregnancies, that is a risk factor for cervical cancer. Multiple sexual partners is a risk factor for cervical cancer. Oral contraceptive pills, when taken for more than 5 years continuously, that is a risk factor for cervical cancer. If there is a family history of cervical cancer, that can also play a role in increasing your risk for cervical cancer. And one of the very commonly known and the biggest risk factor is smoking. Smoking itself is a risk factor for so many other cancers in general, but it's also a standout risk factor for cervical cancer. So these are the risk factors which we should keep in mind. And again, if they club with any red flag appearing, then definitely get in touch with the doctor to get yourself checked up. In countries like US and UK, as I mentioned earlier, there are screening programs going on wherein every 3 years the ladies are checked for, a smear test is done, wherein HPV infection and the cells are tested for any discrepancy, and if so, then the further tests are done. These are repeated depending on which country, but these are repeated 3 to 5 years. Now, cervical cancer, luckily for us, it takes its time to grow from HPV infection to precancerous stage to cancer and then to spreading. So it can be picked up earlier on, and smears do help us a lot. So every 3 years, don't miss your cervical smears when you are called for, because they are a big help in detecting any cervical cancers that might appear later on. Then, as I mentioned earlier, in teenage years, we have this vaccination programs. That program itself has brought down cases of cervical cancer and also deaths due to cervical cancer massively over the last few decades. So these are the two mainstay preventative and screening steps that we in the Western world. I hope this information regarding red flags, the key red flags, and the not less important, but the ones which we might tend to miss, those kind of red flags, and then the risk factors, the information regarding these, you find them useful. If you would have any further questions or comments on this information, do leave some comments in the comment section, or you can do it by coming in contact with me on my socials. I will definitely get back to you with the answers as far as possible. Take care. See you later.